Hi, this is Wendy Briggs with Hygiene Diamonds. I'm coming to you today with a quick video about why I think perio profits are down in your office. I've worked with hundreds of hygienists all across the country, and I've noticed a few things that are quite alarming, to be honest with you, about why perio profits are down. You know, in our crazy economy, we really need to make sure that we are maximizing the potential increase from especially these bread and butter procedures like periodontal services in our practice. I'm going to share with you today why I think these profits are down. 3 big challenges that you face that translate to less production in hygiene, especially with perio services. Probably the first one is frustration on the part of the hygienist in not being able to get the patients to accept services. You spend all this time going into what the disease is about, what's causing it, and what they need to do about it, and the patient doesn't move forward. So I think our own personal limitations with our presentation skills holds us back from presenting perio as the best alternative or the best treatment option for that patient. It's just easier to do the regular cleaning, watch it, and check it next time. So I think one of the biggest challenges is lack of presentation skills at getting patients to accept it. I think the second one would probably be, you know, we are unsure of all the newest research, the latest and greatest. There's a lot of great tools that we have, and we're not sure about how to implement it, what systems we should have in place. For example, lasers. We've got great new chemotherapeutics. We've got a whole bunch of new research about how the body systemically reacts to the pathogens that are causing periodontal disease. And there's so much information out there, it can be overwhelming to hygienists. And so instead of incorporating what we can a little at a time, we just ignore it. And many offices are still treating perio today the same way that they did 5, 8, 10 years ago. And as such, we're not maximizing on the potential profits there like we could be. I think the third challenge that we're facing is scheduling issues. You know, some of us really don't have anywhere to put perio patients. I was with an office not too long ago that they were not treatment planning any scaling and root planing because they had no place to put them in the schedule. Therefore, they just weren't diagnosing and recommending that it be done, and that's extremely dangerous, not to mention, you know, kind of ridiculous really when you look at the profits that are being lost and the patients that are not being served at the utmost level of our capabilities. So, you know, those are some major reasons why I think perio profits are down in possibly your office and many offices across the country. And, you know, the exciting thing is it doesn't have to be that way.